Dear Heavenly Father, as we grow towards you, you make it clear to us that you are absolutely crazy for us and that you want more than we want to be near us. And Father, we pray that the things that we do will draw us closer to you. In the name of Jesus Christ, amen. Okay, so the kidneys do a lot of work, but there's not a lot of credit given to them. I mean, if they are functioning, we usually don't know it, other than the fact that we produce urine. Okay, so I'm going to go through a little bit of anatomy, a little bit of functionality, and then we're going to get into some of the major illness groups, and we'll go from there. Okay, so how many know where your kidneys are? They're kind of underneath where your rib cage stops. They're just about half of them would be underneath your rib cage. Now, if you turn the person sideways and you said, okay, where are they front to back? They are right against the back wall, actually under a sheath of what's called peritoneum. It's just a sheath of tissue that hold them against the back wall, okay? And so they're on either side of the spine. And you see this is your aorta, and this is your vena cava. So these are your two major blood pipes in your body, okay? This one's going out to the body, this one's coming back to the heart. And so what we have is it feeds this through the artery, and then it filters it and sends it back out into the rest of the body. Okay, sends it back through the vena cava. Okay. So the kidneys are kidney bean shaped. Who knew? Okay. They're about the size of your fist. They're not very big. Okay. And they're flatter than your fist. I mean, if you roll your fist up, it's pretty thick. A kidney is only about 1.5 inches, 2 inches thick. It's not very thick at all. About every day, two kidneys filter 120 to 150 quarts of blood to produce 1 to 2 quarts of urine. Okay? How many quarts of blood do we have in our body? Well, it does depend on your size, but there's about 5 pints of blood. So we actually have about 1.5 quarts of blood in us. It's not very much, but it's in tubes, and so it.
I wonder, every time I gave a pint of blood, feel like I'm going to pass out. The doctor told me not to do that
They're
anymore.
taking 1/5 of your blood, which is it's okay for most people. Most people can do that. They can take a pint and you're okay. You start taking much more than that and you're not. Okay, the kidneys maintain the composition of your blood. So your pH balance, some of the things that are in your blood, whether it's a contaminant or whether it's a nutrient, it'll either take those out or put those back. And so it also prevents a buildup of waste and extra fluids in the body. So if you have too much fluid, your kidneys will say, let's get off that water weight or get off that excess fluid, and it'll excrete those. Again, it keeps your electrolytes, your salts and sugars and things like that all in a balance, so that it maintains your need for a lot of your nutrients. It even helps to keep the hormones in balance. And so sometimes when you're done with a hormone, it's going to excrete it out in the urine. It regulates your blood pressure. One of the ways that it does that is in the next slide we're going to see what's called Bowman's capsule and the glomerulus. And what happens is this is the filter. And so this is the wad of blood vessels. It comes into a filter and it filters through that. And so if that gets plugged up, it'll raise your blood pressure. Okay? Because it backs up. Let me back up one slide here. Nope, 2 slides. It backs. See, this red artery comes in and it'll hook up into Bowman's capsule, and if it's plugged, It'll back up into this artery. Well, if you have a backup, even on a freeway, what happens? Right. A lot of honking. That's right. That's what's going to happen to you. So you're going to have an increase in pressure in this vessel. Okay? So you could have what's called renal hypertension. They would do some tests that I'll show you a little bit later, and those will check for filtration rate and things like that. Kidney is not one large filter. Each kidney is made up of millions of filtered units called nephrons. Each nephron filters the same amount of blood. The nephrons include a filter called the glomerulus and the tube. The nephrons work through two steps process. The glomerulus lets the fluid and waste products pass through it. However, it prevents the blood cells and large molecules, mostly proteins, from passing the filter fluids, then pass through the tubes and send the needed materials back into the bloodstream and remove waste. And finally, the product becomes urine. Okay, so it's going to reclaim as much nutrients or as much good things as it can before it sends out the waste. Okay, so it's a great recycling plant. That way you don't have to eat so much to keep your health. Your kidneys and your liver and even your colon are all reclaiming at the end of the cycle, so that you don't have to drink more water, have more potassium or other nutrients. And then it's thrown away. Okay, so here's your kidney, and here is your renal artery and your renal vein. And this comes down from the aorta. This comes back out into the vena cava. And this is what it looks like if you were to just do a cross-section of the kidney. So if we blow up one of these pyramids, it looks like this, okay? And so you can see that there's a capsule up here, and obviously this is even blown up inside of it because they're not that big compared to this pyramid here. These things are microscopic. They're very, very small. They're like capillaries, okay? As a matter of fact, this is a capillary coming into Bowman's capsule, and this is called the glomerulus. And so it goes through all that filtration, and what it does with it is it will reclaim nutrients. It will separate out blood vessels. Your red blood cells never go beyond here. Okay, they come in here, and they're captured and sent back out. But there are other things like contaminants and things like that go through here, and water comes through here. And if your body is dehydrated, what's it going to do with that water? It's going to save it. It's not going to make it into urine because you need that water. So it reclaims it, sends it back into the body, and maintains the tidal volume of your blood Okay, and so then it sends it out into some collecting ducts and like that, and eventually it's made into urine. Now, if you're drinking lots of water, what color is your urine?
Clear.
It's clear, right? What if you're not drinking lots of water, or you wake up in the morning and your first urine and like that? What color is that? Apple juice. It's kind of dark, right? And that's because your body is saving water when you're not drinking it, so that you're not wasting the water, but you're getting rid of the contaminants. And it'll use what water it can, but it wants to save it first, and then it'll send out all those contaminants in whatever water's left. And usually, like overnight, you're going to have a concentrated amount of waste and particulate that goes out in your urine. Okay?
So it smells stronger when
It does smell stronger, right? Okay, so working or not working, when the kidneys are doing their job, we don't notice it, right? I mean, you know, going to the bathroom is part of life. It's just what we do. But when they're not working, and I've got a somewhat of a secondhand experience with this. My brother had kidney failure at 21. He had a staph infection in his kidney that settled in his kidneys when he was 17, and by 21, his kidneys were out. And so he's been on dialysis. He had a kidney transplant, and it lasted for about 10 years. And I think now he's been on. Let's see, he got a kidney transplant in '90. It went out in 2000, and so he's been about 14 years without a kidney, and he's on the list again. As a matter of fact, they just made a trip. They were down south in Oregon, and they made a trip to Portland just to see if he was a match for a kidney. And they had.
He has one functioning kidney.
He has no functioning kidneys. He goes in 3 times a week for dialysis, and he's been doing that for, well, he did it for 10 years. He did it for, I think, 10 years before he got this kidney, and now he's done it 14 years after he got his kidney failed. So, and they don't last a long time. You know, they have to put it on rejection drugs, and you have to have a special diet. And I mean, it's a. I've told my brother that I said, you know, I'm not afraid of treating just about anybody, but transplant patients are different animals, because mostly what I do is I build the immune system, and you can't do that with a transplant person.
Yeah.
You know, you know, because now you're fighting yourself. So when they're not working, it's pretty evident. I mean, you can have a bilirubin backup. You can have a filtration not functioning, and pretty soon your body's pretty contaminated. So how would you know other than feeling bad? Because here's what's going to happen. If your kidneys aren't functioning well, you're going to build up nitric acid, uric acid, things like that. Your kidneys get rid of an awful lot of acids, okay? And that's why the pH of your urine is usually lower than that of your saliva or your blood. And so you're getting rid of a lot of acids. So you can do a couple of blood tests, serum creatine. This is how fast muscle tissue and things like that are being broke down and repaired in your body. And so this is a main constituent of muscle. Once you have that information, you can actually do this next step. It's a glomerular filtration rate. And it's just a calculation. And it says, okay, based on these other numbers, this nitrate and the creatine, you can determine how fast or how slow or how efficient the kidneys are getting rid of these toxins. Okay, and a lot of these are metabolic toxins. They're stuff that your body's going to produce no matter what. Even if you're doing everything right, it's going to produce it. So we want to know, we can do a blood urea nitrogen test, and it'll tell us how fast things are breaking down and being repaired. Now, not everything is based on the function of it. If we were to look at some other tests like ultrasound and CT, we might have polycystic kidneys. In other words, they would have multiple lesions on them, causing a deformation and eventually affecting function. Okay? A kidney biopsy. Most times if they're doing a kidney biopsy, they're looking for kidney cancer. Okay? And so kidney cancer, I'm going to tell you right now, if you were to ask me about biopsying cancer, my opinion is, if you know it's cancer, then you shouldn't biopsy it, because have you ever seen a water balloon, and you stick it very carefully with a pin? What happens? As long as it doesn't blow up. Let's say it doesn't blow up. What happens to it? It starts to leak. So if you think that you might have cancer, the last thing you want to do is stick a pin in it and pull it back out and have that leaking into your system, okay? I'm not a big fan of biopsies for that reason. Any kind of biopsy. Now, the one that is not like that would be a cervical biopsy, and what they do there is what's called a cone biopsy, and they just go in and they chop off the end of the cervix, and so I mean, as opposed to taking a little needle full of tissue, they actually cut it. He's just trying to help.
Not awake yet.
Okay, so we've all had urinalysis. Oh,
Does this have to do with the clogged arteries too, or not? These
No.
are totally something different.
This is totally different.
Okay,
We're
okay.
talking about the function of the kidneys.
Yeah. Okay, I see. Thank you.
What's that? No. Actually, the reason for the microphone is so that it registers on the camera. It just takes that sound to the camera, not to amplify it. Okay. Yeah. Okay, so a urinalysis, we can tell a lot from a urinalysis. We can tell how much protein's in your urine. We can tell how much glucose is in your urine, nitrates. We can tell if there's blood, if there's white blood cells. So we can tell quite a bit from a urinalysis. And most of this it's not a heavy lab thing. You can take a dipstick and go like this, and they've got chemicals on pads on a dipstick, and it'll tell you if there's blood, if there's glucose, if there's protein, things like that. It'll tell you all of those that are there, and they'll change different colors, so it's not guesswork. You just dip it in and then wait for it to turn, and then you write them down. So it's real easy to do a urinalysis.
Can I go back to cancer one more time?
Yep.
Let's say I have a mass, a growth.
Okay.
I can feel it. The doctor
Okay.
says, well, it looks like it could be cancer.
Okay.
What would you recommend to find out?
Well, first of all, depends on the type of cancer we're talking about. You know, if you're saying on your neck, we could be talking to thyroid cancer or something like that. If you're talking in your abdomen, we could be talking about reproductive organs. You know, if you're talking about your colon, digestive things. And so what I recommend is that we get as close to a diagnosis as possible without a biopsy. And many times we can do some blood work and find out that the immune system's fighting something.
And I can see if there's an orifice, you can put a camera up there
Right.
and look at it. But
That's
if
right.
it's
If
if
it's
you
inside,
can't, yeah, if
right.
you,
Then, you know, we would treat it as if it were cancer.
meaning surgery.
No.
No.
Meaning that we would change lifestyle, we would meet nutritional deficiencies, we would detox and things like that in order to give the body the fighting chance against that cancer that it would need. Okay?
But in order, so you would not normally
we
or
don't have-
ever recommend
most
chemo or
times,
radiation.
We don't have to biopsy something in order to see what it is, because we have MRIs and CTs and things like that. We can tell what the content of that tumor growth, whatever it is. We can tell what the content is, how well the blood supply wraps around it, things like that. All cancers want voracious blood supplies. So we don't necessarily have to stick a pin in it to say, okay, well, that's a tumor, or and to say it's benign or malignant. You know, we know how we know the characteristics of a lot of these cancers and like that. So I don't think that it's necessary most times to do a biopsy. And what we may be looking at is whether or not it is truly malignant or what have you, based on the types of cells that are in there. And that's one of the things that they can tell with a biopsy is the type of cell. Okay, but we don't necessarily need to know that it's squamous cell versus basal cell. You see,
What you're going to be doing,
Yeah.
you don't need that information.
we're going to have the body corrected. So, you know, there are lots of diagnostics that are a lot less invasive and leave the body less compromised. Yes.
So, kind of in line with all this, you know, you have the yearly things that men do and women do. Do you have a different recommendation to that, or do you recommend that?
As far as like a mammogram or a colonoscopy or things like that, I would recommend that people get a checkup on a regular basis. Now that may not be every year, but maybe every other year, depending on how they're feeling and like that. But colonoscopies, they, as long as they're mostly diagnostic, I'd say, I love diagnostics. I like to know, what we're dealing with. As far as a mammogram, I actually prefer the thermal imaging that they have nowadays as opposed to a mammogram. Thermal imaging. All cancers have a heightened metabolic rate because they're growing faster. And so they produce more heat and like that. And so if you do a thermal imaging, you're going to see an increased metabolic rate based on that tumor or what have you. And it will actually show up on camera as opposed to going in for a mammogram, which can be quite uncomfortable. This is not uncomfortable at all. You sit across the room, they take a picture of you with a special camera. It tells you, hot spots and things like that. And so, does that make sense?
But I have also heard that these type of treatments can, in and of themselves, cause cancer,
Which type of treatment?
like the mammogram and.
Well, the mammogram is invasive in that it significantly squishes a body part.
All right, Linda.
So it may be trauma, but I don't know that I've ever heard or seen literature that said that a mammogram could facilitate or cause cancer. Well, and even now, radiation, the types of radiation that they're using, the cameras that they're using, the X-ray machines are so fast that the amount of radiation is negligible. I mean, you can get more standing in front of your microwave than some of these X-rays. So don't stand in front of your microwave. Okay. Well, I'm just saying, don't stand in front of your microwave. So yes, now the radiation that comes off of them. If you were to have a mammogram once a month,
Once a year. We don't want once a month. Once in a lifetime.
the radiation would be too much if you had one once a month. Okay, you wouldn't want that. But I think that we get better effect from a thermal imaging because even with a mammogram, it's difficult to tell if a mass is calculus or if it's a fibroid or if it is a cancerous tumor. All they know is that there is something there that maybe shouldn't be, whether it's calcification of a mammary gland, or if it's a fibroid, or if it's actually a tumor. It's difficult to tell with an X-ray because mostly X-rays tells it's looking for soft tissue. I mean, it's looking for hard tissue, which would be bone or calcification or things like that. So it's that's not always the best imaging. And if they said that, okay, we see something on a mammogram, the next thing that they're going to do is they're going to send you for some other kind of imaging. Whether it's a contrast like a CT or something like that, or it's an MRI. And so then they're going to be able to see the soft tissue. They're going to say, okay, this is a cyst, this is a fibroid, this is and I know this has nothing to do with the kidneys.
Yeah, I had a, what do you call it?
Mammogram?
No, the other.
Colonoscopy.
Yeah, 10 years ago, or maybe less than 10 years ago.
Okay.
But it saved my life because there was something on it,
Yes.
and he took care of it, and it was going to turn into cancer, and we caught it just in time.
Right.
So
So-
it does save lives.
So I am not opposed to any kind of diagnostic imaging. We want diagnostics. As a matter of fact, we as Americans live longer because of diagnostics. If we can do early detection and things like that, we'll find it, will be able to help it faster and things like that. So we like diagnostics.
I have one more.
Okay,
I had a lung biopsy 10 years ago.
okay.
What does that affect? Was that a good idea?
Well, what was the outcome of the lung biopsy?
Well, he didn't really find much, but he was trying to find out
So,
what I
see,
had.
all they did was
Just trying to
poke
find out.
healthy tissue. Had they, if there was actually a tumor in there that was
Mm-hmm.
cancerous or what have you, what they would have done is they would have poked unhealthy tissue and allowed those unhealthy fluids and like that to be leaked out into either your lung or into the rest of your system.
Because I have a lung disease, and they were trying to find out what I had.
Yeah.
But I'm not really sure. I don't really for sure if they did, but they might have found something. I'm
Okay.
not really sure, but
Well, they should let you know that.
well, yeah, they probably did. I just don't remember.
Okay, so so your analysis are beneficial to find out what the body's actually doing. The health of the kidney, these tests can measure the function, infection, filtration, obstruction, and other diseases like polycystic kidneys, urinary tract infections, and kidney stones. So what are some of the causes of these diseases? Now, obviously, if we kind of start backwards, we know that if you have trauma, that, that can be, if somebody punches you in the kidneys or you're in a car accident or something like that, it can cause blunt force trauma, right? And that I've heard of contusions or bruises on the kidneys, okay? Abuse, if a person drinks excessively or takes in other kinds of toxins, even medicines and like that can cause this kind of trauma. Overuse, if you are continually having to over-filtrate everything because the amount of toxins that are in your body, it's going to wear them out. Infections, repeated infections will actually cause scar tissue on your kidneys, and the lack of support. If we don't give the kidneys the building blocks or tonics that are beneficial for the kidneys, they're going to break down. So excessive toxins to filter out, a larger burden than normal. Not enough water. Most people are dehydrated. Okay, they do not drink enough water. Okay, and so it's difficult to flush away the waste when you're not drinking enough water. Okay, an acid lifestyle. Now, why would an acid lifestyle cause problems with the kidneys? More acids to flush. That's correct. Now, the other problem is that when you have an acid in your body, what's going to happen next? Your body is going to produce a calcium to buffer it. Okay? And so when your body produces a calcium to buffer it, what happens is that calcium becomes inorganic, or it becomes useless. So what's your body going to have to do with it? Get rid of it. It's gonna cause some sort of impact on your kidneys because if something, I have a patient right now who's dealing with this exact thing, and both his kidneys and his bladder are becoming stiffer because of the calcium buildup inside them. They're not working the way that they should. They're not deflating or what have you based on the amount of calcium deposits that are being excreted into the bladder, okay?
So with diabetes, is it the high sugar level that causes damage to the kidneys?
It is the high sugar levels, but it's also the high insulin levels that occur, because you got to remember that a diabetic doesn't produce normal amounts of insulin. They produce more insulin than what a normal person would need. And so that insulin is a direct predecessor to prostaglandins, which is pain and destruction. Okay, so in diabetes, it's more about the chemical process that affects the kidney. Okay? Hygiene. We're way better now than what we were, 100 years ago. But by the same token, hygiene could be one of the biggest factors of whether you have a kidney infection or a urinary tract infection or what have you. And so, having good hygiene is going to keep this from happening. Emotions. How are emotions going to affect your kidneys?
That affects everything.
Emotions affect everything. Okay, we can go right back here to acid lifestyle, because if you have hate, anger, irritation, and all that, all of those create acids in your body. Okay, and so these are some of the causes, and if we look at kidney stones, the number of Americans that are affected by kidney stones are nearly 1 million per year. Okay, the U.S. population is affected annually is 0.5%. The portion of the population who have at least one kidney stone is 12%. Of these, and on, relapse rate and all that. And here's the most significant thing. First of all, Japan is, let's see if I can find it.
Right there. Right there.
Right?
To the right.
This one. Okay. Countries with fewer stones than the United States is Japan and Sweden. But you look down here, it says overall incidence of kidney stones in Japan and Sweden is increasing. Overall incidence of kidney stones in the United States is increasing. Okay? So we're all getting more stones. And so we have a lifestyle that perpetuates this. Okay? Yes?
So then if we do have kidney stones, we don't have to do anything about it unless we have problems, right?
Well, I would say that we want to do something about it before we have problems. Wouldn't that make sense? Okay? So the first thing that I'm going to show you is what if you are having problems? Okay? And that would be where I would start. Okay? If you're not having problems, then that piece of paper in your hand would be the best place to start. Okay? So I've used this over and over and over. I've used it without apple cider vinegar and just increasing the lemon juice. It doesn't work quite as well. Okay, so what we have here are two acids. Do you see that? Why would we want to put an acid into our body if acid is creating a hypercalcific area in our body? Why do we want to do that?
Aren't we lacking?
We're not increasing the stomach acid, although, adding lemon, drinking it like that will increase the stomach acid.
The body utilizes acid foods. The body utilizes acid foods as an alkaline. The reaction is alkaline, right?
Well, that in some cases that's true. However, your body cannot be totally alkaline. You know that, right?
Right.
We can't have a totally alkaline body. It has to have some acids in it. Now, how many of you, when you were in grade school or maybe in high school, did an experiment where you took an egg, a boiled egg, so as not to make a mess, a boiled egg, and you took that egg and you dropped it into vinegar and you waited a few days. And then you pulled that egg out and you stuck it on the end of a wide mouth bottle and you lit a fire underneath that bottle. And what did it do? It sucks that egg right into there. Now, does it break the shell? Why doesn't it break the shell? It turns rubbery. In other words, those acids have decalcified the shell of that egg. Now, we're talking about getting rid of renal calculus or kidney stones and things like that. We're talking about decalcifying them. Let me show you real quick what I don't know that I put it in. I didn't put it in here. So let me show you real quick what a, it's, where is it, or where does it?
Well, I just didn't see where the apple cider vinegar came in. Was it lemon juice and apple cider
Yes.
and olive oil?
Correct.
Okay. So equal amounts.
Okay, so can you see this? Let me blow that up a little bit. Maybe I can't.
How much portions?
That is a kidney stone. Little razor blades, that's correct.
So does that mean what you're trying to do is round the edges?
Hold on. Oh, you got it, okay. What, yes. So you're doing two things. Number one, you want to soften the edges or round them, okay? The second thing is if you take all the calcium out of a stone like this, what do you have left?
Stone.
Jelly. It's just kind of a gelatinous mess, okay? Now, if you're trying to pee this out, what's going to happen? Little blood in your urine, things like that, right? Okay? This isn't the only one. Let me show you another one here. Let me see if I... You see those? Okay?
Some of them are big and solid, so that would even
They
just
would,
the size of it could cause bleeding.
and see, this is what might happen here is you get a stone in here, and you see that it's bigger than the ureter, right? What's it going to do to the walls? It's going to scrape it all the way down, right? Get it in here, and what happens is this is now an obstruction. This is probably the most dangerous situation because now it's backing up. Now most of us have multiple kidneys, and it'll the other one will take over and start filtrating, but once this gets down here, you have another passage that you got to worry about. Okay. Now, if you're doing something that dissolves these, turns them into gelatinous jelly, it can be flushed out without pain or anything like that. Had a good friend of mine who was in Fresno, and he got kidney stones, and his mother and father rushed him to the emergency room, and they basically gave him lots of pain medication like that, and they said, well, we think it'll pass. So as soon as he went home, then he started doing this protocol and got rid of them within a few hours. Do you see this? This is an X-ray. Okay, this is the kidney. Do you see the shape of the kidney? You can see those. This is called a staghorn. It kind of looks like an antler, but it's actually renal calculus built up on the inside of a kidney, and if any little piece breaks loose of this, it's going to go down. So remember, you said, should we wait until we have a stone? You may already have one.
I do.
So all we're waiting for is it to break loose.
It already has. On the X-ray, you can see the little pieces. It already has broke loose, but what it is I didn't understand because you showed the big part, but now I understand because it's broke loose, and on my X-ray I can just see the little tiny stones, the two
Right.
stones. Yeah.
Right. So this is something we might see on an X-ray. Everybody who has a stone doesn't look like this. They may not have those staghorns or this representation. You may not be able to see them at all on the X-ray. Okay. Here's another one. You see that? Whoa. This is calcified clear down to the bladder. Okay. And so your kidney stone test came back. Just like right here.
Formula where you have. Can we go back to that formula? You have to mix 2 ounces of organic olive oil with 2 ounces of organic lemon juice. I didn't see the rose vinegar there.
Okay. Let me get rid of this. Get rid of that. Go here. Okay. So you're going to do this. This is one. There, the 2 ounces. There you go. Here we go. Okay. So at the first sign of symptoms, your pain, you're going to mix 2 ounces of organic olive oil with 2 ounces of organic lemon juice. Drink it straight and follow it with 12 ounces glass of purified water and wait 30 minutes.
What happened to this vinegar?
Just a second. Just a second. Then, then squeeze the juice of a half a lemon and 12 ounces of purified water into 1 tablespoon of organic raw apple cider vinegar. Drink and repeat the lemon juice, water, and apple cider vinegar recipe every hour until the symptoms improve. Sometimes this only takes 2 or 3 hours. Okay? Now, this is not prophylactically. You do not do this on an ongoing basis. This is an emergency. Yeah, this would be something she would want to do. You would actually, the paper you have is probably where I would start with that. So back here real quick and then over to Rella. Okay, go ahead.
You'd mentioned there was something to soften and take off the edges.
Yes. Because you remember the story about the egg? It decalcified the eggshell, so the egg was able to be sucked into that bottle. Okay? The same thing is true here. What it does is it softens or decalcifies. The acid breaks down the calcium and it allows it to be passed out without damaging more tissue. So you might still have the stone the size that it is, but you can now move it because it's soft and gelatinous instead of hard and crystallized and having big jagged edges on it.
Okay, I was thinking of cholesterol, and I wasn't sure between cholesterol and calcium. So
Okay.
yeah, now
so-
I understand
so
the difference in.
This is not cholesterol.
Yeah, right. So it doesn't have a thing to do with the cholesterol at all.
No.
Yeah.
No.
Okay, I understand. Thank you.
Okay. No. This is not. That would be with the liver, and this is with the kidneys. Okay. There are, some similarities in that gallbladder stones can be calcific also. Most times they're made of cholesterol, so they're somewhat soft, but they can get hard. These are almost always calcium.
So what do we do to prevent that? Can we, we don't know if we have a stone. Can we
Okay.
do this
So
for
very
one day?
first thing is you want to be on a non-acidic lifestyle.
Okay.
Okay? And if you're on a non-acidic lifestyle, then doing the cleanse once a year, twice a year is extremely beneficial because it'll actually wipe out
So this one here.
any cholesterol,
Okay.
any
Thank you.
calcium that might be in your kidneys or your urinary tract.
Okay. Thank you.
Okay? All right. So kidney infections are a little bit different. Okay? We're not talking about necessarily a buildup, although the acid lifestyle still comes into play, and so does the lack of water and things like that. So the place we want to start first is what feeds bacteria? Sugar, processed foods, things like that. Things that are highly refined feed bacteria because they break down into glucose fairly rapidly. So we want to get rid of these things before we do anything else. We want to get rid of these refined foods because it feeds the microbes. The next thing is hygiene is crucial. Where does those microbes usually come from? Well, a lot of times they come from the outside and come in, right? And so we might have a hygiene problem. More water is essential. There's no other liquid to replace it. Okay? If you don't get enough water, and I'm not talking about smart water or vitamin water. I'm not talking about anything that's in a bottle that's other than just water. Okay? We want to talk. This is the most important part. The solution to pollution is dilution. Okay? So we want to get enough water. And if you've got an infection, and the amount of water that you typically should drink is not enough, because you want to be flushing. You want to be going to the bathroom more frequently because you want that water to be moving through. Once you've done these things, you can move on to the next step, okay? You want to support the kidneys, and a lot of what's on the paper that you have with those herbal combinations, a lot of those herbs are kidney supporters, like juniper berries and uva ursi and like that. Those are excellent. Cranberries actually keep the bacteria from attaching to the walls of either the kidneys or the ureter or the bladder or the urethra. So this will keep, and now, am I talking about 50% ocean spray? What am I talking about here? I'm talking about 100% cranberry juice that's tart. It doesn't have any sugar added. It is, I mean, when you drink it, it makes your face turn inside out.
Where do you get it?
What do you do with raw cranberries?
Raw cranberries, you can make a tea out of them. You know, you can boil them, and like that. That's probably what I would do. Is I would make a tea out of raw cranberries. You could juice them. There's not going to be a lot of juice come out of them, but especially, yeah, I would probably make a tea out of them. Hold it. Where's our?
As a source that's easy and readily available, what about those products that I think it's Knudsen puts out, just tart cherry, just, in this case, just cranberry?
Is it just cranberries?
It's pretty acidic.
Okay, so if it's sour, that's what you want. Okay, you want it to be a non-sweetened, organic strawberry, organic cranberry, because it will stop the bacteria from being able to set up shop in your urinary tract. It will actually keep them from grabbing hold of your tissue.
You boil them?
You just boil them. They're a berry, and so let's say you bought some organic cranberries, strawberries. You buy some organic cranberries, and you throw a handful into a pot and simmer them for 20 minutes, and then you just strain off the tea. You can throw away the berries, and then you drink that tart juice.
You say the juice.
The
Okay,
juice.
I was thinking you had to mash the berries or something. I didn't understand it. Okay, thank you.
You're just making tea, and tea will get through. And you know, when you're dealing with liquid, where's it going to go? Okay. So then if you're dealing with an infection, and we've got, you know, we're not feeding the infection, we've got a good flow of urine, we've stopped the bacteria from clinging onto the walls. Now, anything that's left we can kill, right? We can use garlic, golden seal, olive leaf extract, grapefruit seed extract, and all of those are natural antibiotics. Okay? Turmeric has lots of qualities. So it is a natural antibiotic. It's a natural anti-inflammatory. It's also tonic for most of the tissues that it touches. So turmeric is something that you could easily add to your diet, whether you poured it on your food or took it in a capsule. It would be one of those that you'd want to add to this. Okay? Now, I'm not saying that you should take all of these for this. What I'm saying is you could take you could take a bulb of garlic a day. You could take a fairly high dose of golden seal. You could take a fairly high dose of olive oil, olive leaf extract, or grapeseed extract. But I'm not saying you need to take all of these in order to, yes, you could put or after this, garlic or golden seed or you see what I'm saying? Okay, so you don't have to take all of those. It's just, these are great antibiotics. Okay? Okay, so what you have in your hand would be something that you would do for maintenance. Okay, so you're not having an acute bladder, kidney, urinary tract infection. You're not having a active attack of a gallstone. This would be what you would do to get keep your kidneys in good working order. Okay, and so it's a lot like the liver cleanse, except the herbs are different. If you've seen the liver cleanse last week, a lot of the wordage is the same, except that morning drink. You know, there's a morning drink, and then there's a tea that goes along with it, and some droppers. But you're going to do a day of raw foods. You're going to do 3 days of juicing, and then you're going to do a day of raw foods, and then you resume your regular diet on a lighter scale because you're coming off of a fast. So you don't want to end a fast going out to Golden Corral. Okay, so we want to make sure that you understand that. Then this would be the same thing you want to do before you start having troubles. You know, this isn't something, oh, I've got a bladder infection, I want to do this. This is going to help, but it's not going to treat specifically the bladder infection, okay? But if you are having problems with your kidney, starting now is the best time to do something about it, okay? Because it cleanses, supports, detoxifies the kidneys, and improves their function. That's what the kidney cleanse is for. And so you have all the instructions for the kidney cleanse, and then if you need herbs, if you don't know where to get them, I can certainly help you out with that. Okay, but those are the instructions, and it's really very easy. It's doing it that becomes the hard part.
Could you briefly describe a non-acidic lifestyle?
Non-acidic lifestyle. Okay, so first of all, we're going to have a good quality diet. Now, that's going to be different for different people, and we want all of the allergens out of the lifestyle, whatever that is. I mean, let's say that you're allergic to nightshades, or you're allergic to peanut butter, or you're allergic to milk, or what have you. You want to get all of those things out of that diet, whatever it is. And then you don't want to be consuming things that create acid inside the body, which is almost all animal products. Okay? And there are a couple of other things that create some acid inside. You want to be eating a lot of things that alkaline the body, which are your green leafy vegetables and things like that. Oh, by the way, just on an aside, I'll continue that in a minute. One of the things, if you start having kidney stones and you go to a medical doctor, what is one of the things that they say to stay away from? Spinach. You know why? Because it has oxalic acid in it. Okay? Now, oxalic acid is one of the constituents of most kidney stones. Where does that oxalic acid come from? It's part of a waste product that is produced by an acid lifestyle. Okay? Does it come from a green leafy vegetable? Well, there's oxalic acid in it, but it doesn't cause the kidney stone. You see what I'm saying? It actually does exactly the opposite. But it's kind of flawed logic. Well, because there's oxalic acid in spinach, it stands to reason that it causes kidney stones because there's oxalic acid in kidney stones. You know, it's because A, then B. And that's faulty logic.
So it's okay to eat the spinach?
It is okay to eat the spinach. Raw. That's the best way to eat it. Yeah. Oh, hold it. We gotta.
Well, my question was the same as hers. So you can put spinach, okay, in your green drink? And
Yes. And you won't get kidney stones because you're actually alkalining your body. Okay? So you want alkaline, you want your body to be alkaline so that it doesn't have such an acid lifestyle. Now you can't eliminate everything that creates acid, but if you are continually taking in alkalining food substances, then it definitely is going to be beneficial. Now, we also don't want to take in any harmful ingredients, you know, things that are high in sugar, things that are going to turn quickly to glucose or sugar, like refined things, so we want to eliminate any kind of toxins that we may be putting in our bodies. And so then from there, we need to deal with things that might not be something we're putting in our mouth. It might be anger or emotional issues, things like that. Even unforgiveness, things, because those things create unhappy chemicals in our body, basically. Okay, and so those unhappy chemicals can cause acid to be produced in our bodies. Let's see, what else? Does that kind of give you an idea of what or not how not to have an acid lifestyle? I think right behind you here.
So about how much sugar should a person have a day?
Well, you can have all the sugar you want as long as it is bound up in something else, like an apple or an orange or something like that. You can have all you want because it's slow. It breaks down slow. It doesn't. It's hard for you to absorb, so your body takes longer to use it. There's lots of fiber with it. However, if you take a teaspoon of raw sugar and put it in your mouth, it will decrease your immune system function for 26 hours. Okay?
Wow.
So 1 teaspoon. Now it doesn't completely just wipe it out, but it decreases its capacity for 26 hours.
Wow.
Okay? So
Okay.
it's important not to add raw sugar to your diet, especially if you're fighting something that's an infection or something like that. Because number one, that's acid producing, and number two, it decreases your immune function. And so there's a lot of ramifications to having raw sugars or highly processed foods in your diet because of that reason.
Okay, so can I replace it with honey instead?
You can replace it with several things. You can replace it with nothing at all, depending on what your needs are.
Yeah.
I mean, you could acquire the taste. Let's say you're putting something in your tea, and you kind of like it a little sweet, and you just sweeten it a little less, sweeten it a little less, sweeten it a little less, and pretty soon you're okay with having a straight glass of clover tea. You see what I'm saying?
Yeah.
Or you could replace it with something that is a little less harmful. Honey, agave, stevia, something like that. Most of those are still refined, but they're less harmful than pure honey, beet, cane type of sugar. I mean, not honey, beet or cane type of sugar.
Yeah.
Okay?
Well, agave and stevia make me really sick.
Then don't use them.
Yeah, so I don't
Yeah,
do
if you want to
those.
use
Yeah,
a
so
little
just I can use
bit
just
of honey.
Yeah.
That's a
Okay.
that's a good alternative.
Okay, great. Thank you.
It's gonna be around his neck in a minute.
Is honey sugar?
Honey is a refined sugar, okay, but the body uses it a little bit different. It's still not. It's not as easy. It's not as easy to break down as raw. I mean, as granulated sugar. It takes the body a little bit more to do that, but it's also sweeter than sugar, so you use a little bit less. Honey is a good alternative to regular sugar. Not everybody likes the taste and everything of honey.
Yeah, I was just wondering why people beat up so much on honey. I have 2 or 3 books on honey that have all kinds of statistics. Like beekeepers live much longer than the regular population, and all the different diseases that they heal with honey. And I mean, there's just multitudes of things that they use honey for. It doesn't seem like there's much negative about it.
Well, and I don't find a whole lot negative with it either. To diabetics, it's a little, we want to, again, stay away from things that are refined and sweet and things like that. But by the same token, I've read quite a bit about Manuka honey, and Manuka honey has a lot of healing properties. Years in the past, they would put honey over a burn especially after it had cooled down and was trying to heal and like that. And honey is completely bactericidal. In other words, you know, one of the places that a bacteria grows real fast is in a burn victim. And if you put honey on that, it keeps that bacteria from even starting. And so, you know, there's lots of good things about honey. So,
My mom has poor circulation in her legs. I think it's from varicose veins.
okay.
Anyway, every now and then she'll get an ulcer, a little ulcer, especially if she hits her leg against something.
Right.
And the only thing that will heal it really fast is that Manuka,
Right.
Manuka honey. Yeah, you just put it on and then put a bandage over it, and the next day the ulcer's gone. It's incredible.
It
So-
heals a lot faster than most other wounds.
Yeah.
We also had another experience with honey. We had our neighbor brought over a goose that had been shot, and it had a big hole inside. You could see its lungs working. And we just poured honey on it, and about 3 days later, it was completely healed up,
Isn't
and
that
it took
amazing?
off.
Back over here.
What kind of honey are they talking about?
Manuka.
How do you spell that?
That's a good question. Yeah, yeah.
What?
Manuka.
Thank you.
Hmm?
We had been trying everything. It had been going on for weeks with these ulcer problems. And I had, you know, talked to doctors. He'd looked at them. We had tried everything that was recommended. And then one day we were in a store, and this lady happened to hear my husband say something about he needed something to help heal an ulcer. And she said, oh, and she told us about Manuka honey. I'd never heard of it in my life. So they had it. It was at Pilgrim's health food store. They had some. And we put it on, and the next day it was all, you know, healed and drying up. And so we were very grateful, and we felt so happy that we'd found something that worked.
Absolutely.
Can you use that?
You just put it on the salve and then put a Band-Aid over it.
Oh, on your foot?
Well, anything.
Any wound.
Oh, I thought it had an ulcer.
It is, but it's outside. It's an opening in the skin on the outside.
You have it on your stomach. Hole and ulcer.
It probably wouldn't. Yeah. If it's bleeding, cayenne pepper, and other than that, you want to do some cabbage with like some carrot and apple juice and like that. Cabbage is wonderful for healing ulcers.
Yeah, can you use, what do you call that?
Manuka honey.
Yeah, Manuka honey, like in teas or
You can, but it's expensive as compared to regular honey. So if you're just going to use it in tea, just use regular honey.
Really expensive.
Oh, wow.
Okay. Anybody else? Up here.
Why I know I have good pair of kidney, but I have to get up and go in the bathroom 2 or 3 times every night.
Okay. So some of that could be when you are drinking your liquid. Some of it could be when you're drinking your liquid. Okay. I had a patient probably about 6 months ago, and she was a very small person. She was probably about 5 foot, and somebody had convinced her that she needed 3 quarts to a gallon of water a day. You know, she was a very small person. And so she said, I'm having trouble sleeping. I'm constantly urinating and like that. And so I went over for a visit to her house, and I said, okay, when do you drink your liquids? And she says, well, I start in the morning, and I drink all through the day, and if I don't have it all drank by night, I get up in the middle of the night and I drink in order to get all this liquid in. And I said, look, you're too small for that much liquid. Let's do the amount of liquid that you need, and then stop at about 6 o'clock in the evening. And she called me back and she says, the very first night, she says, I slept all night. I'm going, oh, praise the Lord. Getting enough water. So, you know, stopping about 6 in the
It's been
evening.
many years to not step through a whole night without waking up.
It might be your prostate. I'm just kidding. It would be something we'd have to look into, see why. Okay? Well, maybe. Okay. Anybody else? Let's have a word of prayer. Our loving Father, we thank you so much for teaching us and helping it to be lively and fun and insightful. And Father, we pray that this knowledge will be stored away and given to somebody who really needs it at the appropriate time. We love you and praise you in the name of Jesus Christ. Amen.